Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health. Welcome back to Digital MD, the podcast where we talk to leaders in digital health ecosystem about innovation, decision-making, and how we think. I'm your host, Dr. Liz Kuo, and today I'm thrilled to have Ian Chiang with us. So Ian is a former healthcare consultant at McKinsey, also a mobile health entrepreneur and a health tech service operator at Cigna Care Allies, which is a huge payer insurance company, now turned venture capital investor at Flare Capital Partners. So Ian, thanks for being here.
Thank you so much, Liz. It's truly my honor to be here.
Well, Ian, I just really appreciate your career path. And before we dive in, wanted to ask you sort of what drives you. We are going to go into some of the questions on what had you move from entrepreneur to actually being on the payer side and then now an investor. So tell us a little bit about yourself.
Yeah, thanks, Liz. You and I known each other for way over a decade. So I hope I not bored you with some of my past history.
Not at all.
But I'll start maybe even from the very beginning. And I think you and I know each other, first met when we were in business school, both Taiwanese immigrants to the U.S. So as a typical Taiwanese American immigrant, we were brainwashed by our parents that becoming a doctor is the medical doctor is the only path to be successful in the health in life, right? So
which is not true. But yeah.
Clearly, I'm not successful in my parents' eyes, so I'm just hoping my kids will one day be a doctor. But,
You're perpetuating it.
so yeah. So as a new immigrant to the States, and of course, like went to college, study engineering as well as pre-med. So very early on, I got myself into the discovery of healthcare, so working NIH from the labs and others. So throughout even since early in my education career, I knew that I wanted to do something in healthcare, and we've been a patient ourselves. So I was actually born with a congenital eye disease. So since an early age, I have seen the miracle of healthcare, right? What could really make a difference to a patient and to me very specifically. So I wanted to contribute to the next wave of innovation throughout my academic career. When I was a senior, as I was applying to MD PhD programs, and maybe this is also a little bit of having worked in a lab, like college and academic scholarship to focus on research. I just wanted to try something a little different, right, before I commit myself to the next how many decades of my life into a certain field. So having many friends who are applying to different consulting firms. So somehow I ended up getting an offer by McKinsey, which I'm sure in retrospect, it was a huge mistake on McKinsey's part. So I totally became a consultant, and that started my business career in healthcare. So went on to get my MBA where I met you, and then became a founder, like early stage startup, worked at large companies, and now an investor. I think all throughout that kind of career arc, I would say what really motivated me, and I think it goes all the way back to being patient myself, right? Really wanted to see how we can innovate the healthcare system and to do better for the patients, right? Because we all know that at some point our loved ones, ourselves, are going to be the recipient of the healthcare delivery one way or the other, right? So I think that started motivating me as I was thinking about different ways I can create impact, since I'm not a physician like you, can actually make real, tangible, personal impact to each of the patients. So throughout my career. Yeah.
I will just say this, like, it's interesting because I talk to a lot of physicians and clinicians, and a lot of people feel burnt out and not excited. They're always looking at the grass on the other side and feeling like grass is greener on the other side to be in business. So it's nice for you to give a shout out to clinicians sometimes that don't feel like their careers panned out the way that they wanted to. And then also on the business side, yes, there are people that, wish or wanted or still consider going back. But I think there's a way to create meaning and a lot of wonderful career opportunities, regardless of what your foundation is. One thing I actually also tell people is to consider engineering or biomedical or other things that give them a little bit of a different business flavor within healthcare. So appreciate all the shout outs. But yeah. So I would say, just to understand too a little bit more, you were saying you thought about yourself as a patient and then got into healthcare through McKinsey, but what made you end up going to Cigna? Because that's a really interesting jump there, and or start some of your other companies.
Yeah, I would say, as I mentioned, I accidentally became a consultant, which, of course, McKinsey is one of the best training ground. My career is a collection of, I guess, fortunate accidents that collide into one big, like, big and happy, like kind of uh, harmonious accident toward the end. But when I went from McKinsey, and I knew I wanted to start something that can be much more scalable and make the direct impact in driving our healthcare innovation. I was fortunate to be a student of Clay Christensen's when I was at Harvard Business School. So really bought into the disruptive innovation, healthcare being an industry that needs to be disrupted, right? So started off, fortunately, one of our mutual classmates, like he recruited me to help him to be one of his co-founders of a startup. So saw some of the early stages, of course, some of the challenges. And then as I continue to see the evolution of the healthcare industry, I do believe incumbents have a way to potentially scale impact in a much more meaningful way than just any startup, right? So like any good Clay Christensen students in this disruptive innovation theory, we were taught to be an evangelist, right? So I wanted to be an evangelist in a large, like in a corporate environment to help create disruptive innovation. So when I joined Cigna, it wasn't joined just to be a payer. It was to help Cigna start a business that helps provider advance towards value-based care, right? So Care Allies was a startup within a really large company, although day one we had like hundreds and hundreds of employees, right? So not a real startup.
Right.
The goal is to self-destruct because healthcare at the time, 2015, still by and large fee for service, right? So Care Allies was a force for Cigna to help move the market towards value-based care.
Absolutely. And it sounds like it's worked very well. I mean, we are seeing still a trend across the board into value-based care. Of course, it has to work with the right analytics and the right incentives. I think a lot of value-based care, the first year, it's very hard for them to have a downside risk. So everyone goes upside, but then there's not a lot of goals to move the needle. So are you seeing some changes also in value-based care arrangements?
Well, yeah, no, it's really interesting because I would say when I got to Cigna in 2015, when we launched Care Allies in 2016, right? Like, and many of my Cigna colleagues, as well as my former Cigna colleagues, they have been leaders in value-based innovation for decades, right? Literally decades. Some of the first versions of value-based care, depending on whom you talk to, some of the healthcare story, and of course, we can always trace all the way back to the formation of HICE, right? But we have also seen in the 90s, the HMO movements, right? Those are also just some forms of value-based care that we talk about today. So I think we have made great strides, but there's still a lot more to be done, right? Like I think we have seen the evolution on the MA side, but commercial is still lagging quite behind, right? So there's still a lot more to be done. I'm very you have to be an optimist to be in our space, right? Building startup or backing startup. So I'm cautiously optimistic, right? And of course, we all want value-based care to move a little faster. Uh, it is just a reality, right? It's not a technology solve. It's not like some sort of magical, clinical pathway solve, right? So much of what we do day to day is really about changing people's behavior in a very complex healthcare ecosystem. Takes time. One thing I
Yes.
would say, and before I pause, is I am more and more encouraged over the last 2 years to see specialty care
Mm.
moving towards value-based care, right? It doesn't have to be full risk delegated model. And we have some very successful portfolio companies at Flair, like Somatis, did phenomenally well, right? Helping payers moving toward that full risk capitated model. But
Mhm.
even for some of the other specialties, you're starting to see payers creating case rate, right? Like to
Mhm.
really moving towards like on that continual value-based care. So I'm very encouraged by that, right? Because in 2015 we talked about it, but we didn't see anything.
And are you seeing on not only traction on the payer side, recognizing that that's an interesting business model to invest in and scale, but you yourself also as an investor, you're seeing additional companies getting into the space too?
Yeah, like certainly, and of course we're seeing all across the different specialties, right? I still
Mm.
remember her, even l- like very early on in my Cigna career.
Mm.
So I was brought on, and my goal was one of my KPIs, if you may call it, is to
Mm.
help care allies, right? But I still remember a funny story. Like I got a call from HR, and HR is like, Ian, we can't hire you into a company that doesn't even exist, right? So large companies like HR process, and they were right. And then so my first job at Cigna, I actually have like a very interesting role. So
Mm.
I moonlight, tried to help stand up care allies on the side. But my day job was actually to support Cigna's US operating committee across a number of things. So almost like, I mean, hard to describe it, almost like an internal consulting team.
Would
Like,
you This is almost an interesting pivot into a big payer, meaning you could still have some autonomy running your own startup and having some ability to be agile and build a business, but you also still had the Signum backing. Would you recommend people to try to look for opportunities like that? That seems like a nice pivot from an entrepreneur into an executive space. And then at some point, I want to ask you, what did you learn? Because now that you know
yeah,
what you know, how would you have run your own companies differently?
yeah, like, and I would say, I definitely would recommend because I think, looking at the U.S. healthcare, right? Like, so I think innovation, we need innovation across all fronts, right? Not just startup, also incumbents in partnership, right? And also policy. I know in your book you talk about all the P's, and then
Hmm.
so we need everyone to focus on innovation. I absolutely would recommend folks look for opportunities uh, to sort of work for a innovation or startup within a very large company, right? Whether or not it's successful, I think that aside, and probably to your point, I think no matter what, the person will learn a lot, right?
Mm.
And I do think that when innovation works within the large company, and this is Clay Christensen, a lot of his theory, I am gonna do this. I just keep on referencing his theory. I would encourage all your listeners to read Innovator Dilemma, Innovator Solution. I actually have it somewhere
Mm.
in back.
Great books.
But what it really is like truly some of the most innovative, disruptive changes are really driving from within the large incumbent, right? And in healthcare, this is also so important, right? Like, because when I was building startups, or when I was working with startups, maybe you can impact, like thousands, tens of thousands, and even low single digit million. That's amazing, right? But if the goal is to transform healthcare, create impact, right? You have to
Hmm.
work with the incumbents, right? Because be it
Yes.
Cigna or any major health plans, like if we can move innovation, even the needle by a few degrees, like we can impact tens of millions of lives, right? And
Like Mark
perhaps
Cuban's Cost Plus and other areas that are looking at PBMs. Yeah, it's
exactly.
true. Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at home testing for health plans. Their convenient, member centric approach has helped plans achieve industry leading results. In just 1 year, Everly Health Solutions helped a multi state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com. And so, another question that came up then for me is, how would you have built your companies differently now that you know what you know in Cigna's side? Because I experienced that quite a lot on knowing what I know from Elevance, like the ways I would scale. I talk about it in the book, but also things like um, prove yourself early and fast, because the champions that champion you may not be there in a year or two. The ones
Well,
that took on the risk of their careers using another vendor outsourced, they may not have the budget in the following year. So you need to prove yourself correctly, early, fast. You also want to show outcomes. So getting them the information that they can now align with the rest of their team, or show their boss's boss, or show their teams that they're being effective. And then also getting within 1 year of the ROI. I didn't always know this, that the insurance companies, if they're going to deploy you, they want to know within 1 year if the ROI is worth it. Because not only are they, a lot of them are public companies, so they have every 90 days a report card, but also they're actually working on medical cost reduction within 1 year, especially in the fully insured, but also national accounts. A lot of employers, maybe it's a 2 year, 3 year timeline, but for them, so looking at that, I feel like that's such a key learning for me. Was that true for you too when you were at Cigna?
Oh, 100%. Liz, you said it better than I could ever articulate it. And I 110% agree with everything you said. And ROI is so important, right? I think a lot of entrepreneurs, like, including myself back in the days, right, fail to fully like appreciate is just the kind of the financial pressure. And this is again, it's not just a publicly traded company. You worked at Elements, have worked at Cigna, they're a
Mm.
publicly traded company, but even the nonprofits, right? Like
Mm-hmm.
every single day, the operators are dealing with trade-offs, right? Opportunities. And you and I know, like many of the people, when I was the SVP of Product and Solutions at Care Airlines, right? And this is even before digital health became a real legit categories, right? Like there will be days I get like 20, 30 companies reaching out looking for partners, right? Like you need to, number one, from what I learned, like you said, you need to be able to demonstrate ROI, near-term ROI. I think one other thing I would say, maybe just expand one of the points you made
Mm.
just now, is really what I have found in a lot of founders.
Mm.
They are solving for a problem. Of course, I think what we personally experience when acutely, we feel emotionally attached and we wanted to solve it, and which is an amazing way to start a company. You have to have founder problem fit, right? The personal motivation. But I think a lot of the founders I talk to, or even my past self, like what I have learned is sometimes the problem you're solving are just not that important. It is important to you, maybe important to a small group of people. It's just not that important in the grand scheme of things, right? So in addition
Yes.
to the ROI, yes, maybe there are solutions. When I was yeah, I'm not gonna use real number, but I would just use like a sort of rough range of numbers, right? So part of my job was Cigna has a portfolio process that we have a large team. Every single business from Cigna will submit requesting for funding, right, to drive
Mm.
innovations. And part of my job when I first got to Cigna, helping, in addition to helping standing up Care Allies, was also being that business person. I'll partner with my like the finance team, the so and so, to eventually go through iterations and iterations of selecting that thousands of lists of submission for something important, something with potentially with strong ROI,
Yes.
eventually Cigna can only fund something like 30 of them, right? I'm not holding real number, but you can imagine like if you have the 30 firms, right, you can have
Yes.
all the ROI and everything, you just don't make the cut, right? So you have to be solving a problem that's important enough to a large group of people, right? Like,
That's right. A large, and I think of this too in one way. It's like large enough volume, low cost, like so musculoskeletal, but it's like a lot of volume of medical costs. So if you can solve even just a little bit, but there's so much volume in, let's say, surgery prevention, MRI imaging, repeated, needed, those are medical cost reduction. There's also low volume but high cost, like a NICU stay or sometimes C-sections. Those are also high volume, but that trade-off, if you can reduce a NICU stay or a C-section and have a natural birth or other things, there's savings there. I also, you hit on this too, which is when they're looking at their whole cost of care bucket. I didn't know that we had to think about preventing ER visits, preventing length of stay. So not just that they're gonna get an admission into the hospital, but how long they're gonna stay. And those are metrics that all the payers are keeping track of. So because the other buckets aren't as expensive, like DME, kind of home monitoring, those are reasonable things. But I think the largest ticket items I did not realize were really the length of stay, the hospital admissions, and preventing all of those really reduces medical costs. So a lot of I think founders, I don't always see thinking through that. They kind of think, like you said, maybe this is one small area that they're really focused on and they personally experienced it, but they don't realize on the grander scheme of things where where in the list of priorities it fits.
yeah. And obviously, Liz, I think I want to add a caveat by saying that there's a differences in building businesses for digital health businesses that sells into enterprise, right? Well,
Yes.
B2B2C versus direct to consumer. And of course, I think many of the successful direct to consumer companies are built based on deep and lived personal experience from the founder side, right? So I don't want people the takeaways is dismissing like solving the problem. But if you
True.
are building a solution that's like helps me, right? Like what helps yourself, but looking to sell into the payer, really try to think from understanding the needs of your buyers, right? I think I often have like the voice of the customer probably trumps the voice an entrepreneur has in his or her head, right? At some phases of their product development.
Yes, actually, good point. I do think the reason why we talk about this too is that consumers are willing to pay too. But whenever I've talked to founders that want to go into the payer space to get a reimbursed, that's when they hit all these roadblocks. But consumers oftentimes also don't always want to pay for chronic disease issues. Like they don't want to pay for diabetes or all these other things that they think their insurance company should pay for, but they might pay for wellness, cosmetics, other things. So it's interesting, or sleep, watches and wristbands and other things. And then that also branches sometimes into the employer space where employers, their purchasing patterns are slightly different too, because there's stickiness and retention and driving less productivity. So hoping that their employee productivity increases and there's brand loyalty to them when they do have these employee benefits. But I feel like when it's just pure play on the payer side, it's a different story. And Medicare different from Medicaid, of course. But I would love to also try to understand from your perspective as you're building these consumer brands, are you looking at that too? Do you think it's a hot space? I'm seeing some interesting work in women's health, fertility, even as we're now seeing menopause in other spaces. And you must be seeing all of it too. Precision genomics, some of the other work on liquid biopsies directly to the consumer, functional medicine and testing and diagnostics.
Yeah, no, it's we're in such an exciting phase of healthcare innovation, right? Both on the digital health front, technology, also many of the diagnostics you highlighted, right? So I'm more excited about the overall innovation landscape than I ever been
Mm,
throughout my 20 plus years of nearly 20 years of my professional, right? And
wow.
um, I, I, I think one thing about, and maybe there are a couple of things I want to comment real quickly, having to go into anything in detail. I think consumer brands are so important So I think at the end of the day, healthcare is a business of trust,
Mm,
right? Whoever can build that most trusted brand.
mm,
And of course, over the past many decades, it's been the individual level. Like I go to you, Dr. Paul, because I trust you. We have a long like friendship and relationship. Or I go to you like my
mm,
local health system, right? Because that's the most trusted partner. So I do think that there's a window, well, maybe not just a window, right? There's a huge opportunity for many of these quote unquote startup innovator, right? To be able to build a brand that one trusts, right? But we also understand healthcare, unlike, like Netflix, like back in the days, like if they lost my CD in the mail, DVD in the mail. Not sure
yeah,
how many of your listeners still remember the early days of
right.
consumer product. You can potentially
Mm,
fail to deliver or something happen, and consumers will give more of a benefit of the doubt, right? When you can make it up to them in some ways, right? Oh, 1 month
right.
free, uh, give you two more DVDs, right? Uh, in healthcare, since it's so personal, right? So I think for all the companies that try to build a brand, like don't take shortcuts, right? Do the
Mm,
right things, because you can spend all these years building up the brand, and overnight one bad PR can potentially
mm,
throw out your brand value. Right? But I do think that building the brand is such an important and critical aspect, and whoever is going to win the heart and mind of the consumer, right? The patients, that will have the long sustained power of about innovating in our ecosystem. I think on the
that's
other
true.
hand, like a lot of the innovations, right? I think be it diagnostic or even on the AI side, right? I know we probably will talk about AI. So again, going back to that phrase, like innovation only happen at the speed of trust, right?
Mm,
So the whole ecosystem goes back to the trust, right? So I think a lot of what we have seen, some of the challenges in innovation, it doesn't have to be just in women's health or other, like it's about how do we build companies, right, that can win the trust of the consumer. Of course, women's health, I think we fundamentally haven't done enough to address like more than half of our population, right? So absolutely more and more innovation needs to be happening.
yes. I love that you said this innovation side because I think a lot of people also are trying to connect like where their personal goals are, where their mission is, what they're hoping for their careers, for their life. How do they line with a company that resonates with them, and then find that business model that makes sense. How have you navigated all that? Like how do you make your career decisions when you jump from one to the other when you think about this? Because I think a lot of people want to innovate, but they just don't always know how. Or even like how do you network? Because people always ask me like which conference to attend. Which ones do you attend? I'm always curious.
Um, well, I would say, of course, I chair a number of conferences. Folks should absolutely attend those conferences I chair, but no, all
You should
joking
mention
aside,
them.
yeah. Well, so I think, of course, there are some large industry conferences and trade shows. So of course, in healthcare, probably in healthcare services or healthcare IT, like HLTH,
Mm,
like of course, like more on the enterprise SaaS side, like HIMSS, and there are a number of conferences. There are more focused conferences. Like every year, I help co-chair a conference, I co-founded a conference called Health Next, which
mm,
is centered on Cornell Tech's. I also went to Cornell for college, so
mm,
has a personal affiliation of Cornell's, but we really focus on bringing together academic scholars, industry practitioners, physicians, and others to talk about a very specific topic. You
mm.
also have the HIS East and the HIS West that are more digital health focused, right? And there are so
Right.
many other conferences. I think for me is like um, it's about it's not just about attending the conferences for the sake of attending. It's also about the thoughtfulness and building the relationship.
Mm,
I always find myself, and maybe this is also my career has been a series of accidents.
mm,
So I think whenever I try to network or go into something, I haven't a sense of what I want to get out of it, but I take a very learning approach, right?
mm.
Like I want to learn, get to know people, learn from their experiences, and then I will, continue to build off of those relationships, right? Some of the people industry contacts I still partner with on a fairly regular basis started from those one-off conversations long ago in some of the conferences.
Mm.
People, um, I would say probably should take more of an approach, just try to spend time, quality time, getting to know the other person, and oftentimes that's the best outcome come out of those kind of unassuming lack of agenda interactions, right?
That's interesting. I definitely agree with some of that, most of it, actually, all of it in terms of personal connections. I also then I take one step further and I do spend quite a lot of time early in my career. This was in my 20s, focused on who's speaking, what's the agenda, what do I want to learn from this person, and then I'll set up one-on-ones with people that I know are attending so that I can have those important interactions. One job that I got actually was from a conference from Harvard Business School. I looked up the speaker. It was Steve Osterly at Medtronic. He was a SVP at Medtronic, very high up, did M&A. And I kind of knew he was speaking. I listened, and then I found him afterwards, and I cornered him. I brought a friend with me. I actually like strategically like kind of hovered around his group, and then got to know him by just like kind of squeezing in and saying, hey, like I just want to introduce myself. My name's so and so. I ended up getting an internship at Medtronic through him with this just one interaction because I kept in touch with him. Over the years, I sent him books and things that I read, articles. I just think, like Ian, you were mentioning, some of these need to be nurtured over time. People always ask me, how do you get mentors? And I think it's because those relationships over time, because of him, I ended up joining a board of a company. And I think some of these things, if you're able to, at the right place, right time, learn to connect with the person on a very personal level and get to know them and remember them and make it not just about you and your mentorship, but what you can give to them. I feel like you're very good at this too, Ian. You've done this with a lot of people that I've known, you stay in touch with. So it's wonderful to actually have that perspective on conferences too.
Well, yeah, thanks, Liz, for saying that. I definitely think that what benefits is really ultimately, no matter what we do, building business or funding business, it's all about the human relationship, right? So
Mm.
being able to establish that and then nurture that, and then also just present a genuine self, right? Like so I think I'm a fairly transparent person. My
You are.
well, there are people with public persona versus private persona. I try to like maybe I'm just not smart enough or savvy enough to have two, right? But I think ultimately life is also too short, right? I just want
Mm,
to be who I am and then work with people whom I love and trust. And
mm.
I think that so far has served me well, right? And yeah.
That's such a nice thing to end on. Do you have anything that you feel like we didn't cover that you'd want to mention? Anything? I know we talked about some AI work, some technology, your career, your amazing path to different areas that you've learned and advice to entrepreneurs. Anything that you want to add on top of that before we go to the hot takes?
No, but maybe one thing I would just encourage, especially given your listeners are people, entrepreneurs, as well as people who are looking to start companies or maybe backing companies, like just continue to try to focus on solving the real acute needs that exist in our healthcare system, right? Run towards the challenges. I know it's always easy to build the next, like, whatever that's the hottest thing at the
Mm,
moment, focus on solving the real problem.
I
That's
love
my
that. That's a very good, I would say, not only call to action, but a focus on what fundamentally matters as we're thinking about our life. And Ian, you've also been very thoughtful in helping me go through some difficult times with family planning and all this stuff. And I think we're grateful now with kids and how we manage. But you're right, life is short. So I think you have to seize the day. So Ian, it's been an absolute pleasure. I really appreciate all the time that you've dedicated to this, and always asking really detailed questions and being introspective about it. So let's go through the hot takes. I know you have about 4 things that you could share with the group here.
Great. Well, so where should we start?
Best advice?
Best advice to be genuine.
Great. I totally agree with that too. How about hardest challenge and how you overcame it?
I think the hardest challenge I would say is how to balance work life and also raising a family. I think Liz, you and I have talked quite extensively about the challenges of being busy working parents, right? And I think the hardest startups are our kids, right? So I honestly don't know if how that will turn out, but certainly the hardest challenge I
And
have ever.
rewarding. Any
Yeah.
tips on that? Because if you have any tips, I would always welcome any of those.
I think very understanding and supporting spouse and partner would is the key to that, and also always place yourself and be empathetic. Yeah. So
Great.
well, maybe when we do this again in a few years, like you can ask me the same questions again.
Yeah, we'll come back and see if you've learned anything as the kids have aged. What about the most exciting part of healthcare innovation right now?
Yeah, I actually, and of course, this is not meant to be an ad for one of my portfolio company, but we're truly in like an unprecedented like period of innovation when it comes to what we can do to manage obesity, like from a cardiometabolic condition standpoint, right? GLP-1 almost every single week, we're starting to see additional indications, so that's really exciting. And if we can really, obesity is something patients who are affected by obesity, and oftentimes it's not just because of poor lifestyle management, right? It's actually just like, you know, people don't shame others for having hypertension or high cholesterol, right? And I think now that we can medically manage obesity, as well as some of these drugs are quite miraculous, right? Like can really help impact many other conditions. So we're really cost is still high, but I think we're just at the forefront of a real interesting period where we can see some of these chronic conditions that we in the past did not manage well, and now we have effective medications and therapies to manage. And then also gene therapy, right? I mean,
Right.
how amazing is that?
That's great. And then if you had a superpower, what would it be?
Oh, I would love to be a mind reader. So that will really help me for my job, and also help me probably balance the hardest challenge, which is about raising kids.
I like
So
that. Yes, I feel like that would be a really useful power for a lot of reasons. But then you would know good and bad, so it may not be great to know everything about what everyone's thinking about you too. So
that's true. There must be an on and off switch.
yeah,
So
that's right. A filter. Well,
yes,
thank you for your insights and all the strategic challenges you've shared about managing a fund and how forward thinking you've been. It's really enlightening. Listeners, for more on Ian's work, you can follow him on LinkedIn or email him at ian@flarecapital.com. We'll link both in the show notes, and we hope today's conversation has sparked your curiosity and inspired you to explore further. Thanks for joining us, and thank you, Ian.
thank you, Liz.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.